Hello, my name is Angela Bradford, and today I'll be discussing vitamin D supplementation with chronic kidney disease. I am a registered and licensed dietitian. I'm also a board-certified specialist in renal nutrition. So let's get started. Objectives of the presentation today are to describe the purpose of the vitamin supplementation in chronic kidney disease study, understand the functions of vitamin D in the human body, explain the methods and procedures that will be used within the study, and discuss expected results. Let's discuss some of the background for this study. What's the purpose of the study? The purpose is to evaluate the effect vitamin D supplementation has on health-related quality of life with chronic kidney disease patients stages 1 through 4. The concept of health-related quality of life and its factors incorporates the aspects of overall quality of life that can be clearly shown to affect health, either physical or mental. Health-related quality of life is a concept that focuses on the effects of illness and specifically on the impact that treatment may have on quality of life. What is vitamin D? Vitamin D is a fat-soluble vitamin that is derived from a steroid that comes from cholesterol. Once transported to the kidney, the vitamin is activated, and the active form of vitamin D is also called calcitriol. Calcitriol has several functions in the body, including serum calcium and phosphorus homeostasis. Its most widely recognized role is the homeostasis of calcium and phosphorus, with effects on the kidneys, small intestine, and bone. Vitamin D is provided by a relatively small number of foods of animal origin. It's taken in the diet from fortified dairy products as well, and fish oils, or it's synthesized in the skin. The largest quantity of vitamin in food are found in fatty fish like swordfish, salmon, tuna, and sardines. And because so few foods in the United States contain much of vitamin D, select foods can be fortified usually as D3, but sometimes as D2 vitamin D. And the fortified foods include milk, yogurt, cheese, orange juice, breads, and some cereals. Vitamin D deficiency most notably affects the bone. Rickets is the condition caused by vitamin D deficiency in children, and signs of rickets can appear as soon as 6 months of age. Osteomalacia is the condition seen in adults and older children. People with insufficient sun exposure may also be at risk for vitamin D deficiency. Few foods contain vitamin D, like I just previously discussed. Therefore, without daily sunlight exposure or fortified foods, an important risk for vitamin D deficiency still exists. Therefore, for most people, vitamin D is primarily attained by exposure to the sun, so creating the vitamin D with the sun hitting the skin. However, many factors influence the amount of sunlight that actually reaches the skin and its effectiveness. These could include time of day, season, latitude, altitude, what type of clothing that you're wearing, if you're wearing clothes that's covering your skin. Sunscreen use might block sun exposure, pigmentation, and age. What is chronic kidney disease? Chronic kidney disease is described in 5 different stages. The level of filtration shown by the kidneys determines each stage, and that filtration rate is called the glomerular filtration rate. The onset of kidney failure can be sudden or progressive, leading to chronic kidney disease. Patients with the disease continuously lose GFR over a period of months to years. As chronic kidney disease progresses, dialysis or a kidney transplant might be needed for survival. A person with advanced impairment of kidney function usually experiences fluid retention, otherwise called edema, uremia, which is the accumulation of waste products and toxins in the blood, metabolic acidosis, hypertension, anemia, bone disease, or an increased sensitivity to some drugs. What is the relationship between vitamin D and chronic kidney disease? Insufficient vitamin D can also cause secondary hyperparathyroidism, which is seen with kidney failure as the activation of vitamin D is diminished. An insufficiency or deficiency in vitamin D can also cause problems like high cholesterol in the blood or low phosphorus in the blood, as the vitamin is not able to help control that homeostasis that I talked about earlier. The primary functions of calcitriol in the intestines is to increase the absorption of calcium and phosphorus. Elevated parathyroid hormone resulting from that low blood calcium or the high blood phosphorus are primary signals for activating vitamin D. When serum calcium levels are low, the parathyroid releases that parathyroid hormone, otherwise known as PTH, to signal the kidneys to activate vitamin D. Calcitriol responds to those low serum calcium concentrations by causing resorption of calcium from the bone. The vitamin then acts alone or with PTH, causing serum calcium concentrations to rise within the normal range. Calcitriol also increases the resorption of calcium from the kidneys to increase calcium concentrations. The primary functions, like I said, though, is to increase the absorption of calcium and phosphorus in the intestines. Earlier, I discussed vitamin D deficiency most notably affecting the bone. In patients with chronic kidney disease who suffer from secondary hyperparathyroidism, their bones can become brittle and it can contribute to weakness and joint pain. Patients are also more susceptible to bone fractures and breaks. Active vitamin D sterols such as calcitriol and their analogs are used to treat secondary hyperparathyroidism in chronic kidney disease patients. But these analogs are typically not provided to patients until they reach stage 5, which is when they're already undergoing dialysis. I'd like to now provide information on methods and analysis. The population studied will be patients with stages 1 through 4 chronic kidney disease. The sample size will be 2,000 patients based on the sample size used in a similar study that measured the effect of vitamin D supplementation on deficient pre-dialysis patients. Patients with chronic kidney disease typically suffer from multiple medical conditions like hypertension and diabetes. These patients will likely be seen by a specialist every 3 to 6 months to monitor the progression of those diseases, including monitoring the progress or the progression of their stages of chronic kidney disease. Patients with early chronic kidney disease are typically managed in a primary care setting and then referred to nephrologists when their kidney functions worsen. Plans for our recruitment are to hand out flyers to patients. The flyers will be given to primary care physicians, nephrologists, and endocrinologists within the Emory Healthcare Network throughout the city of Metro Atlanta. A little information about the Emory Healthcare Network is that it's a clinically integrated network that provides access to coordinated patient and family-centered care. They have 6 hospitals here in the area, 200 provider locations, over 2,000 physicians, and more than 70 specialties. The network delivers care throughout a range of those hospitals and clinics and local practices, including more than 120 primary care locations in Metro Atlanta. It's a really big network. I think that it will be big enough that we can capture the amount of the study population that we need. Flyers will only be given to patients with diagnosed stage 1 through 4 chronic kidney disease. The physician will only provide information that's on the flyer. They won't have any other conversation about the study. The patients that are interested in the study will be asked to leave their contact information with a designated staff person at the physician's office. The contact information requested will be their name, phone number, and email address. How much vitamin D will the study subjects receive? Patients will be grouped as either deficient, insufficient, or sufficient. Researchers will collect blood samples from all of the patients, and their serum vitamin D will be measured. If they are deficient, that will be a measurement of less than 20. Insufficient will be 20 to 30, and sufficient will be over 30 according to the levels of their serum vitamin D. Vitamin D supplements will be given to patients who are insufficient or the deficient patients. If the patient is deficient, the vitamin D supplement will be 50,000 IUs of vitamin D3 for 12 weeks. If the patient is insufficient, the vitamin D supplement will be 1,000 IUs of vitamin D3 daily for 12 weeks. The patients that are sufficient will not receive a vitamin D supplement. So a questionnaire will be used as an assessment tool during the study, and it includes all of the questions available on the Centers for Disease Control and Prevention's HRQOL, which is Health-Related Quality of Life 14 measure. The 14 questions included on the questionnaire will assess general health and physical, mental, emotional problems and limitations. The participants that do not require any supplementation during the research study will also complete the questionnaire every 3 months along with the other patients. We'll move forward to discuss anticipated results. How will the data be analyzed? We'll use a frequency analysis to evaluate the prevalence of vitamin D deficiency and insufficiency, a chi-square test for categorical variables, and a student t-test for continuous variables will be used to survey the differences to compare the scores between the study participants. And we're using this way to analyze the data based on a similar study. What are expected results? The vitamin D deficiency and insufficiency group will have lower scores in all of the health-related quality of life components. That will be expected. In chronic kidney disease stages 1 through 4, expected results will be that the monthly supplement is sufficient in preventing and treating the vitamin D deficiency. The prevention and treatment of vitamin D deficiency will show an improvement in the quality of life of the patients. And supplementation of vitamin D for patients with insufficiency will also benefit with an improvement in health-related quality of life. So in summary, chronic kidney disease patients suffer from insufficiency and deficiency in vitamin D due to the kidneys not being able to activate vitamin D in the body. And in patients with chronic kidney disease, they also suffer secondary hyperparathyroidism, which causes brittle bones and can contribute to weakness and joint pain. And they're also more susceptible to bone fractures and breaks. The purpose of this study is to evaluate the effect of vitamin D supplementation on health-related quality of life with those patients that are chronic kidney disease stages 1 through 4. 2,000 patients with chronic kidney disease stages 1 through 4 will be recruited for this study. Vitamin D supplementation will be provided to patients that have insufficiency and deficiency. Health-related quality of life will be assessed in all patients participating by administrating a questionnaire that includes all the questions available on the Center for Disease Control and Prevention's HRQOL 14 measures. Here are the references used for this presentation. This concludes my presentation. Thank you for your time.